I'm Kelly Werthmann in the CBSN Denver studio. As the COVID-19 pandemic continues to affect our lives every day, it can also be taking a toll on our mental health. That is why Aurora Mental Health Center is reminding everyone to take care of themselves, and they're here to help with their support line. Erin Ralston is a therapist from the health center. Erin, thank you so much for being with us. You know, we hear all the time that it's important to take care of our mental health, with or without a pandemic, of course, but coronavirus is really causing a lot of stress for some folks. So how is the support line helping people?
Yeah, our goal as the support line is to be a resource that doesn't impede on kind of the stress of daily life, that you can speak to someone whenever you need to about whatever it is that you need. We don't necessarily have the capacity to set appointments and add more things to our daily life, but we get to that point maybe in the afternoon or the evening where we just are overwhelmed. And so the support line is accessible for someone who needs that extra person to talk to, a neutral person to talk to, someone outside the family, whose job it is to listen so that their needs are met in that conversation.
You know, I think you obviously hit the nail on the head. You clearly know what you're talking about, but sometimes just having someone to listen to just kind of what you're feeling, what you're thinking. What do you find, Erin, is a common concern from callers right now?
You know, the biggest thing we're hearing is that people are just done with the pandemic, that they really like to return to some sort of normalcy, and it doesn't seem as though we're going to be doing that anytime soon. So really managing how to cope day to day, how to be getting enough sleep, how to keep up their energy if they've got kids at home, and just managing all of these different balls that people are keeping in the air, right, without letting things drop. And with the pandemic in play, we actually have a bit less energy to manage the things we would normally manage. So we may not be able to cope quite as well. Plus, our normal coping skills might not work right now. You can't go spend time with friends. And if that's your primary coping skill, you need some support to adjust to something that you can do safely.
That kind of leads perfectly into my next question, because, you know, over the last few months, because obviously this pandemic's been around for a bit, we've talked with other mental health experts about how the many anxieties people of all ages may be struggling with, and that includes the uncertainty of the pandemic, like when is this ever really going to truly end? So what advice have you shared with people about coping with that anxiety and what else they can do?
Yeah, I mean, as far as coping goes, it really is person specific. So finding something that helps distract you for a little while. We talk about coping skills and people go, oh, you know, reading for a few minutes, it just distracts me for a few minutes, but that's actually the point. The point is to get you out of the circle in your head of all of these thoughts that you're having, distract you for a few minutes. So doing something that you enjoy. I mean, picking up, I've seen so many people have picked up hobbies like canning and baking, things that you didn't really do beforehand. So finding something that you enjoy doing is going to be really important. Also being patient with yourself, not pushing yourself to be able to accomplish what you normally would have, being kind about what you need. If you need a little more sleep, that's okay. If you need more time to finish a project, that's okay. If the laundry didn't get done today, that's okay. Making sure that you're present and providing for yourself what you would for someone else.
That's such profound advice. Now, if someone is watching this right now, Erin, and they think they could really use the support line, and we're going to give that number one more time, what can they expect when they call?
Of course. So we're open Monday through Friday, 8 to 6, and we have a mental health professional on the line at all times. And we do actually have Spanish speakers available as well. So if someone is Spanish speaking, we absolutely encourage them to call. And we can use translators for any other languages. We want to encourage all of our refugee populations as well to be utilizing support. They can expect a space where they can share as much as they want to share. We will ask some questions, you know, their name, things like that. And then the space is for them. The person is going to say what would be most helpful for you right now, and then the conversation evolves from there. We've done a lot of problem solving. We've done a lot of, you know, what coping skills should we be trying instead? How do we get through a difficult situation in ways that we maybe hadn't before?
And I think pets are oftentimes a help. I see you have one too.
Yes.
Well, we love our
really
furry
are.
friends.
And the adoption rates have gone up on all furry friends, which I think is brilliant because we don't have the physical contact
Right.
that we used to have with people, right? And so having that with animals is important.
Awesome. Well, Erin, thank you so much for joining us today. We really appreciate it. And if you'd like more information about the Aurora Mental Health Center support line, just head over to cbsdenver.com.